One of the frequently asked questions in my office when it comes to filling or filling placement is are they going to hurt? Because, quite often, if you know that fillings can sometimes hurt when they're being placed. And as a youth, I do remember that when I went to my dentist, and he's a great person, but quite often when they would place fillings in me, they would hurt. And I wonder why would they hurt? And also, is there anything that I can do now as a dentist to make it more comfortable? And so I guess maybe what you should be asking is what can be done so the fillings are more comfortable so that they don't hurt. And in our office, I guess we call it the EPL philosophy, if you want to use some letters. Basically, what we like to do for E, we like to use early detection. And I believe that if you detect decay early or the beginning of decay early, the procedure can be much more comfortable. And the way you do early detection is I use microscopes or magnification a lot, and we can detect something so small and treat it so early that it's very comfortable that you don't even have to use anesthetic for treatment. There's other ways to detect the decay too, and so we use every method possible to detect decay as early as possible. Another huge way to do it is through digital x-rays. That's an awesome diagnostic procedure, through making everything digitized or digital x-rays to, again, detect decay early. The P is for basically thinking more proactively or more preventively. So you can either be a reactive sort of dentist or you can be a proactive dentist. And the way I consider myself is I consider myself proactive. So when we diagnose some decay, it's either do we treat it in its early stage, or do we wait, or do we put a W on top of it, or do we put to wait or watch it? Well, why would you want to wait, and why would you want to watch some decay grow bigger and grow deeper? Because the bigger and deeper decay grows, then you're going to get deeper in towards the nerve of the tooth, and that's when you need to, number one, use anesthetic, and number two, you're going to cause discomfort. So I like to be more proactive and more preventive-minded. And the last part of this, or the third part of this, is the letter L. And in our office, again, we use laser dentistry. And with laser dentistry, I have found now, since I've been using laser dentistry, number one, I use a lot less anesthetic. Number two, I can do a lot of procedures without anesthetic. And number three, the laser has kind of an anesthetic effect to the treatment side of dentistry. Not saying that you can do all procedures without anesthetic, but with the advent of the laser, you can make dentistry a lot more comfortable and use a lot less anesthetic. So I think the EPL in my office has been very effective when it comes to placing restorations or doing fillings on patients, and to make it more of a comfortable visit for you. If you like this information, and if you're interested and would like to learn more about our services and what we have to offer, and even more about our office, you should really visit us on www.drheringer.com.